So the Community Health Champions Program is a learning opportunity for community members to get together, collaborate, and learn from different presenters about public health in Central Texas.
I would recommend the Community Health Champions program for individuals who are wanting to make a difference in health outcomes and looking for an equitable society.
I would recommend the Community Health Champions program because it raises awareness and it teaches about how and why we implemented programs that we have in place currently.
The one word I would describe my Community Health Champions program to be is inspiring.
Uplifting.
Insightful.
I would definitely recommend anyone who's interested in public health, anyone who's interested in helping their neighbors to apply.
My favorite part of the program is getting to know different people from all walks of life, different cultures, different aspects, different way of thinking.
My experience through the Health Champions program has brought about a different way of thinking around what it means to live in an equitable society.
I love that they give us an opportunity to continue working with the people that we've met in an alumni program, so we can really keep using the resources and the learnings that we've made.
You should definitely apply to the Community Health Champions program, no matter what your background is.
Hi everyone, good afternoon. My name is Anais Cruz and I'm the Communications and Engagement Program Manager at Central Health. Today we will be talking more about the Community Health Champions Program, what to expect, such as program requirements and how to apply. At the end, we'll open it up for questions, and if a question comes up during our presentation, please feel free to place it in the Facebook comments and we'll address it during our Q&A. Before we get into program details, I'd like to introduce Ivan Davila, Director of Communications and Community Engagement at Central Health, who will tell you a little bit more about Central Health and what we do.
Thank you, Anais, and welcome everyone. Thanks for joining us. So a little bit about Central Health first. Central Health is the public agency that ensures Travis County residents with low income get quality healthcare. We do this by partnering with about 190 clinics, hospitals, doctors, and health organizations to offer a full range of quality healthcare services for Travis County residents with low income. Our primary responsibility is to build and maintain a network of providers for Travis County residents with low income and no insurance. We dedicate 96% of our budget to healthcare delivery, including clinical and hospital services and healthcare coverage. And about only 4% of Central Health's budget is for administration. Next slide, please. And about the Community Health Champions Program. What is the Community Health Champions Program? In summary, Community Health Champions is a program that brings together Travis County residents with diverse backgrounds and perspectives to learn about, discuss, and participate in the work Central Health and our partners. We often hear that about 80% of an individual's health is determined by social factors outside of a clinic, meaning a lack of access to healthy food, safe housing, quality education, jobs paying living wages, and so much more. At Central Health, we understand that by the time people come to us seeking coverage or healthcare, people have endured a plethora of systemic injustices. This is why we kick off the program with a 2-day health equity training. In addition to that training, participants go through a series of 5 virtual workshops to learn more about the gaps in healthcare and health equity in our community and what the Central Health Enterprise is doing to address these gaps. During workshop 1, which is where we introduce Central Health and the enterprise, which includes Central Health, Sendero, and community care. During this workshop, participants will also get to learn more about the enterprise's response to COVID-19. During workshop 2, Health Champions are giving a high-level overview of service planning, healthcare service planning, and how Central Health partners with our healthcare providers. During workshop 3, we take a deep dive into coverage programs like MAP, or the Medical Access Program, MAP Basic, and Sendero Health Plans, which is also part of our enterprise, as mentioned earlier. Participants get familiar with the eligibility criteria and benefits of each coverage program. During workshop 4, Participants take a deep dive into community care, specifically patient outcomes, the methodology to care, and the team-based care approach, and challenges that come along with federally qualified health centers, as well as potential solutions. During workshop 5, participants become familiar with how the Central Health Enterprise the Central Health Enterprise and its partners address social conditions for the covered population, meaning our MAP members, and look at case studies from activities and classes at our Central Health Southeast Health and Wellness Center. Aside from being a part of these educational workshops and panel conversations, community health champions also get to network with fellow members, connect with local leaders and experts, and foster relationships and opportunities to be part of major initiatives in our community. And of course, after completing the program, we like to say, once a health champion, always a health champion. You're not done with us and we're not done with you. Beyond the completion of the program, health champions have a variety of opportunities to get involved. Some of these include, as you can see on the screen and on the photos, chairing or being a member of an alumni association committee, which includes the communications committee, which is in charge of our monthly alumni newsletter and Facebook group content. Also a committee that handles events and programs, and they identify and plan continued education activities such as lunch and learns about equity, local government, and most recently a virtual lunch and learn about health and homelessness. Another opportunity is participating in our strategic and planning and our budgeting process as a government organization. And also once a year, we solicit input from community members to develop our priorities for the following year. Every 3 years, we solicit input from community members to develop our strategic plan. And of course, there's a variety of volunteer opportunities with the organization and the enterprise, including tabling at resource fairs, doing outreach and helping with survey administration at events, as well as our MAP offices and health centers. In our current reality, of course, of living in a pandemic, we've also had volunteer opportunities to help with PPE kit assembly and PPE distribution events. This time, I'm going to turn it over to Anais, who will speak more to the time commitment and the 2021 program schedule. Anais?
Thanks, Ivan. So what we look for in applications for the Community Health Champions program is we like to see that you are a Travis County resident with a commitment to improve the health of the community. You also have an interest in current healthcare topics and have a desire to grow in leadership and in outreach. And so in order to participate in the program and receive a certificate of completion for the program, we ask that participants attend a 2-day health equity training scheduled currently for September 10th and 11th. Attend the very first workshop, which is an introduction to Central Health, as Ivan mentioned earlier, which is scheduled for Thursday, September 23rd. And we ask that participants attend at least 4 out of the 5 workshops to complete the program requirements. And so on this slide, you can see the dates that we have proposed for the 2021 schedule, and they can also be found on communityhealthchampions.net. And so Thursdays, once a month, we meet for our workshops from 2:30 to 5 o'clock. And as I mentioned earlier, the 2-day health equity training is scheduled for a Friday and a Saturday from 9 a.m. to 5 p.m. So a little bit about the selection process. We are currently accepting applications, and these are due Sunday, June 20th. We have a review and selection process that takes about 3 weeks after applications close. And this is made up, our Alumni Association members make up our review committee. And so they use a numbering system so that your names are not shown on the applications while they are reviewing. And we also have a few Central Health staff members participate on this review committee. After that's said and done and we finalize the selected applicants, you would be notified the week of July 13th about the status of your application. So before we open it up for questions, I'd like to introduce one of our alumni members who is here with us today. Her name is Teresa Watkins, and she is actually a class of 2020. So she participated in the virtual program last year. And she's here to tell you a little bit about her experience in the program. And I'd also like to mention that she's currently serving as our Alumni Association president. Teresa?
Thank you, Anais. I'm Teresa Watkins. As a job, I'm a project manager for Medicaid and CHIP services and have always had an interest in improving health of my community. One of the reasons I was attracted to the Community Health Champions program, and as they've mentioned before in the health equity training, that was one of my favorite parts. It was inspiring. It's a wonderful group of people. I'm really excited to be president of our Alumni Association because I still get to see people from my cohort and other cohorts and stay involved in this amazing work. I will say the silver lining of the virtual training is that this year was a particularly busy year for me with the legislative session in process, and being virtual allowed me the time to get to fully participate. I fear if I would have been battling traffic that it would have been a little bit harder for me to say yes to the program. So virtual was definitely a benefit. So even if you're busy, I really encourage you to consider participating. It was just a fantastic experience, and I'm excited to continue my work as a health champion. Thank you.
Thanks, Teresa, and thank you for being here and your continued work beyond the program. That's one of the most exciting things I think about the program is you don't just go through it and, you know, storm off. We actually try to do our best to keep you engaged and involved in our work at Central Health, and Teresa has taken that step to help support our Community Health Champions Alumni Association. So I think we were waiting on one more alumni, but we do understand that he's running a little bit behind. So if there are any questions in the comments, Yvonne, do you see any currently?
I don't see any, Anais, but many times people ask one question, and that is, do I have to live in Travis County to participate in the program? And let's talk about that.
Yeah, so the reason that we have that as a criteria or requirement is because, as we learned earlier from you, Yvonne, is that Central Health is publicly funded via taxpayer dollars in Travis County. And so the point of having Travis County residents participate in this program really just brings it home as far as them understanding where their money is going and how they can help advocate with neighbors or friends and colleagues, and just let them know more about the work that we do and why we do it.
And Anais, do participants have to have healthcare experience to be eligible to the program? And let's talk about that.
Not at all. So we've actually had a range of professions and backgrounds that come through the program. So Teresa, for example, has a healthcare background, but we have had people that come through as engineers or have their own consulting firms, and really they are just trying to learn more about their own community. They may not have a background in healthcare, but they have an interest, or they've had some sort of personal story that has made them want to learn more about why the systems work the way they do.
That's right. We appreciate diversity also of profession, and that is why we also take a look at people who are not in healthcare. And there's a question via Facebook, and the question is, will this be virtual or a hybrid?
So this year, similar to last year, we will do a virtual program. Central Health within its offices and the enterprise are still not having a solidified plan as to return to work. So just to keep everybody safe and within protocols at Central Health, we are going to continue the program to be virtual.
Great. Another question via Facebook, and maybe we can go back to the slide that talks about qualifications to participate. What are the qualifications to participate?
Let me pull that up. We really, aside from being a Travis County resident, we would like for people to really take the time to answer. In the application, you'll see a open-ended question about why you want to be a community health champion. And we really want to hit home that you should take your time on responding to that. We want to see the desire and the interest in healthcare topics, desire to grow and to learn more about what we do at Central Health.
And and get involved, right? We also take a look at community leadership and in terms of either experience, having community leadership experience, or a desire to be a community healthcare leader also in this community. Another question that's come up via Facebook is the participant required to be actively employed? No, that's definitely a no.
Yeah.
But go ahead, nice.
That's a no. There is no requirement to have any sort of employment. As long as you're involved and you're interested, we want to have you.
That's right. In fact, we also like to encourage, everyone from all walks of life. We are very serious when we say a diverse backgrounds, either ethnicity, race and ethnicity, or gender identity, sexual identity, or either in the income scale, regardless of income as well.
Well, we've had all ages come through the program. I think our youngest was a high school student, and
right.
we love to see, like Ivan said, diversity.
That's right. Yeah, in diversity, there's a robust conversation, right? There's an opportunity to have robust conversation and therefore learn from each other, and we become more creative in the way that we problem solve, and so we always want to encourage diversity in our Community Health Champions program. As we were saying earlier, we end the program with the last workshop. There is an activity where we reflect on everything that we've learned, and then how do we apply it to either our work or either professionally or via volunteerism. So as we mentioned earlier, there's plenty of volunteer opportunities, but also if you work in healthcare or in social services, how will you apply it to your work?
Awesome.
One more question, I guess, and then we can get to Mr. Motwani here. What application materials do we need, except for example, resume, references, etc.?
So we don't require any additional documents or supplemental materials. So if you visit our website at communityhealthchampions.net, you'll see that it's just a form on our website, and that is all you need to submit your application. So as long as you answer all of those questions, and again, just to remind everybody who's submitting an application, take time on your open-ended answers, because we really take a look at those and want to make sure that you are interested in and determined to be a community health champion.
Awesome. Let's introduce Mr. Motwani.
Are you doing that? Sorry. You're going to. Well, we have another guest alumni with us today. Amit Motwani graduated the cohort in 2017, and he is actually serving on our board of managers at Central Health.
Just getting situated with something here and wanting to make sure I stay on script. Thank you so very, very, very much for having me here today. This is it's a unique privilege because the Community Health Champions cohort that I was a part of, I believe it was 2017. I think it was 2017. I'm always claiming the wrong year. It's either 16 or 17, but I believe it was 17. It was really salient. And there are a lot. Well, I'll just start by telling you who I am. I am the CEO at the Rupani Foundation, which is a Texas-based organization. It's the U.S. branch of a worldwide philanthropic organization that focuses on early childhood development milestones, and of course, how that folds into the larger public health sphere, in as much as maternal health, maternal mental health, family health, social health determinants, and how all of those things affect childhood development, and then, of course, long-term outcomes. In Austin, I also, before this, have worked at this executive level in organizations like El Buen Samaritano, as well as United Way for Greater Austin, and have been in health and human services in Austin for over 20 years. And so it's of unique sensibility for me, the work that Central Health does, obviously, to ensure that those who need healthcare most have access to it, as well as the work that Ivan, you and Anais have been doing to foster this program and bring folks who are interested in improving systems and outcomes and learning more about it as a whole, bringing folks together and engaging with the community. It's extremely important work. Now, this cohort was specifically really important to me because I see a lot of sorts of groups that encourage leadership around the city. You know, there's X group, that will promote leadership on this level, and there's Y group that promotes leadership on another level. You know, there's corporate affinity groups, there's nonprofit affinity groups. But one of the most just impressive for me was this one. And it was because we had such a unique opportunity to meet folks at every tier of the Central Health organization. And we were able to learn how it affects each and every one of us, whether as investors, meaning folks who are paying into the system by means of tax, whether as stakeholders, meaning folks who are benefiting from the services that Central Health provides to make sure we're all covered. And that means that as stakeholders, we can benefit because our community is healthier, or we can benefit because we've received access to care. And I think what was my favorite was getting to meet all of the experts behind the scenes and seeing how passionate each and every one of the folks who were involved with Central Health was about their work. We often cut government agencies and government-related organizations, we don't cut them very much slack when it comes to being innovative. And it was so wonderful to me. For example, I uniquely remember the discussions around how intentional Central Health was trying to be to improve specialty care, and specifically which zones they were working to improve specialty care in. And in this forum, we were learning from their data systems, to the types of specialty care, to the types of practitioners, to where the referral targets would be, to how wait times would be reduced. Every single aspect of it we learned about. We were able to meet with the dean of the new medical school. We were able to meet, and as well as with Kirk Watson, along with what their plans would be. So much inside information that weaves in and out of a lot of the public interest work that so many of us do. And even if we don't do that work, those of us who are engaged in the community and care about our community's well-being, it's our work anyway. And it never left me. You know, I, from there, realized that so many social determinants affect our long-term outcomes. So many clinical determinants affect our long-term outcomes. And all those long-term outcomes are united at the community level. They're inextricable. And if that's what it takes, if that's what public health is, if that's what it takes to improve the public health is to focus on that, then I wanted to be a part of it. And, you know, I was gifted the privilege to serve now on the Central Health Board of Managers, where that foundational knowledge can be taken to the next level. And I'm able to serve our community in that capacity as well. And I think that joining the Community Health Champions cohort is not only something that's individually fulfilling because of just the wonderful types of people that one can have the opportunity to be exposed to. Who are the kinds of people that really, really care about community health and equity? Those are the people that you're going to be hanging out with for this period. And those are going to be your peers in learning with the experts that I just identified, who are also equally committed to those goals. And what you can do with those connections and what those seeds will grow into in your professional, personal work is just something that you can't imagine or you can imagine. But either way, I think it's fantastic. So I love the privilege of having been able to participate, love the privilege of getting to be here today. Thank you all for inviting me. And thank you, Central Health, for the work that you're doing to keep the community engaged.
Wow, thank you so much, Amit. I appreciate all your candid words and your energy as well. And we appreciate you also being on the board as a health champion. So yes, thank you so much for being here and for being part of this.
And it can't, don't want to miss saying this, but Amit is actually a second health champion to serve on our board. And so we're very proud of that. We've had health champions go on to be part of our staff and also our board of managers. And so it's really awesome just to see how this program has led people to do those things. So thanks again for being here.
Anais, since this is very relevant, we've also brought board members to the Community Health Champions program. At the end, in the last workshop, as we mentioned, we provide opportunities to be involved. And so one of our board members will come to speak to our Community Health Champions about what it means to serve on the board. And we have a robust Q&A session with a board member about what it means to serve on the board, the time commitment, and all of that. So we do encourage our Community Health Champions to consider becoming a board member for Central Health. So I believe we had thank you so much, Amit, again, and Teresa. I believe we had one more question on via Facebook. And Anais, I think you were going to be pulling up a schedule. The question is, talk about the training schedule.
So this here, can you see this?
Yes.
Okay, great. So this is our proposed 2021 program schedule. So we will, like I said, you'll hear about your status of application by the week of July 13th. And when you do submit an application, we kindly ask that you, like in the case that you do get selected, that you save these dates on your calendar. And so we kick off the program again with a 2-day health equity training. We bring in a vendor to conduct this training, and it's about the history of health inequities. And we take a closer look at why we're in the position we are in because of the systems and the way things have been done in the past. And so this kind of just puts things in perspective and kind of gives this vision for the rest of the program and the types of conversations that we have with our participants. And then as Ivan walked us through earlier, the workshops, these are held once a month. Actually, there's 2 in October due to some scheduling, but we get together Thursdays in the afternoon from 2:30 to 5. And these, again, are just learning about the Central Health Enterprise and our partners and how we all work together to have a robust healthcare system here in Travis County. We also give the opportunity for small group breakouts and program workshop reflection exercises. And at the end of the program, we have an annual celebration, which is currently TBD. We could have it virtually like we did this past year. If there, is possibility to have this in person, we will jump on that opportunity as well. But we also invite a keynote speaker, either someone that you might have heard speak at the workshops or someone that we think can bring home and tie it all together for everybody. We also invite our board of managers to be there. They help us give out the certificates, and we also invite past alumni to join us too. We see a lot of alumni recruiting current members, and so it becomes just this big family type of reunion. So that's a little bit more about our program schedule. Ivan, do you want to add anything?
Oh, that's great. And we have a few more questions that have come through Facebook Live. There's Marcy Wilson is also commenting and saying, may I take a minute to talk about new Spanish stroke acronym to recognize stroke symptoms? She is an RN and the Heart and Stroke Community Educator. Marcy, thank you so much for your question and for your comment. Our participants are, of course, encouraged to bring their expertise and their knowledge to each workshop. And so if you applied and become a participant of our program, you will definitely have an opportunity to discuss and bring your expertise to the table during our discussions. So the answer is yes. Perhaps not, a 1-hour training or anything like that, but there will be an opportunity for you to discuss with us what it is that you do for work and how it is relevant to the conversation. There is another question: is an interview involved or an application submittal only? And the answer is you only need to submit an application. Sheila, there's no interviews involved.
Yes.
We have a comment by Ricardo Garay. Ricardo is an alum of the program. He graduated from 2018, and he says he appreciated engaging conversations with folks that have lived in experience and firsthand knowledge of the complex interplay of social determinants. Absolutely. Thank you so much, Ricardo. We still call on you for conversations around addressing complex issues. So thanks for being here.
And Ricardo has been awesome at helping recruit for every single cohort since he's graduated. So thank you for helping us.
Sorry, my kitty is being a little, she wants attention. There's a question around equity training and work and where they're held. So Reyes, Martinez, the health equity training, historically it's taken place in person, of course, but last year and again this year, it'll be held via Zoom. So much like what you're seeing here today, except for not via Facebook Live, this is a program that is by admission only. And so it'll be via Zoom in a virtual room, and our trainers and our staff make a concentrated effort to make sure that an 8-hour training, 2-day 8-hour training is not so hard on the participants. And so we do encourage, well, actually it is a requirement of the program to attend this 2-day equity training to ensure that we have a solid foundation from which to launch and start the program. And so it is held virtually. And I'm not seeing any more questions at the moment.
I don't either. I will just, before we log off, or, you know, we're open to questions, but I would like to invite again Amit and Teresa to join us for any last words, anything that you guys want to share. We're just talking about this being virtual, and Teresa was the first class that went virtual. So Amit or Teresa, if you guys want to come back and join us, and is there anything else that you think you missed in your original comments, or just any words of encouragement for folks that are kind of still on the fence about applying?
Well, this is Teresa, and again, thank you for the opportunity. I will say that the health equity training was remarkable. I don't want to say I didn't notice it was virtual. Of course, I noticed it was virtual, but there was no lack of connection or lack of being able to really engage with members of the cohort that I was meeting for the first time. The trainers were amazing. I literally cannot imagine that it could have been better in person. It was after a year of Zoom, I must say it was the most excellent virtual experience that I have had, and I wouldn't let that stop anybody. And absolutely don't miss any of the community health champion workshops or trainings. They're all fabulous, and don't let the virtual stop you. It's just an amazing, very personal and engaging experience despite being virtual.
Thanks, Teresa. It was definitely a learning curve for a lot of us, whether you're a participant or putting it together on the back end. I definitely don't miss parking situations and things like that. We did get some feedback, actually, that they preferred it being virtual. They didn't have to sit in traffic or, you know, have to take extra time away from work because of commuting and things like that. So for some, the virtual workshops and the program itself really benefited.
And perhaps it's because in non-COVID times, we hold each workshop at a different location. And it's not to throw off the participants, of course, it's to actually immerse everyone into the world of healthcare at the local level. So we've had workshops at Integral Care at a clinic, an integral care clinic. It's a behavioral and physical healthcare clinic, very well integrated in Dove Springs. And we've had workshops at the Dell Medical School and at the Southeast Health and Wellness Center and many other places to help participants really get to know the lay of the land at the local healthcare community. But I can of course see the disadvantages to driving all over town and every workshop being different. And so of course virtual, I can see how it can be more beneficial. Amit, did you have something to add to the conversation? And any other words about, like Anais said, like to participants who are still on the fence about applying?
Well, just to follow up with what Teresa shared, I mean, that's a pretty strong testament. The best Zoom training, I mean, I think a lot of us have sat through millions of Zoom trainings, and like for something to stand out like that, if the health equity training stood out like that, everyone should take that to the bank and keep it in your pocket, because no one goes around lightly saying something is the best Zoom training they ever did. So I want to sign up again, just like hearing that. And maybe y'all will make a special exception for me to join at least the equity training. And in as much as adding to the conversation, I really appreciated what Ricardo added on Facebook. Ricardo, those of us who know him, who should be so many of us, is integral when it comes to really, really appreciating the user experience. And when I'm saying the user, again, we have manifold stakeholders in the ecosystem of health. The community member who is looking for care should be the epicenter of it. And Central Health, I think, does a great job of engaging the community member who is seeking care. And not only do they do a great job of engaging, but a great job of continually working to improve that engagement. It's never good enough. If we engage one person, how can we engage 3? If we engage 3 people, how can we engage 10? We engage 10, how can we make sure that we reach them all in the language that's best for them? And if we reach them all in the language that's best for them, how can we make sure we're addressing the unique cultural, the unique health equity issues that may be sliced by cultural lenses? And how can we continually improve? How can we we're never good enough, and we'll keep getting better. And I feel like I walked away wearing that hat as a champion. And Ricardo is a champion like that. And I'm glad he added that. And those are some of the folks that we met in our cohort. They were part of our cohort. And I'm saying they, but I was a MAP card user at the time. There was something called a MAP card that you would have to apply for if you wanted healthcare coverage. I was uninsured, and it's so scary. It's so scary to have a pain or have something and not know where you're going to go. And so to include the stakeholder, the community member's voice is very, very important. The person receiving care. Those are the people who are part of the cohort. They're also part of the presenter group, and Central Health continually improves in that regard. And as far as your second point, Yvonne, if you're on the fence, perhaps to play out the use of the word champion, if you're even here, you're probably a champion. I mean, if you're caring enough to be in this conversation, you're probably a champion. And again, to reiterate what I was mentioning earlier, that's whom you're going to be surrounded by, though, session after session after session after session. And when I'm talking about comparing to other sort of leadership type cohorts, which, all of them have their distinct values, but the unique value of someone who cares so much about community health, and to be with those in equity, and to be surrounded by these folks, and to naturally, organically, by means of time and experience and shared learning, foster those connections with these folks who are going to be in not just our health champion cohort, but our Austin champion cohort and Travis County champion cohort over the next, however long. It's really, really meaningful, and it's lifelong. And so, you shouldn't be on the fence. You should, and I doubt many people are. I know that the application process is straightforward. And again, just to wrap things up, I very much appreciate how innovative Central Health is, and how it's a chance to be in the fold, to be learning what kind of innovations are incubating in the chamber. So thanks again, y'all.
Thanks, Amit. Man, tough act to follow, but thank you so much. I mean, those you're really, really good at selling our program, which I thoroughly appreciate. And I can honestly say that everything he said is 100% accurate. It's so true. But I appreciate it coming from you, Amit. Somebody in our chat also asked how many people will be selected. There's always a 50% admission rate that we've noticed. And this last year, because we went virtual, we actually selected fewer participants because it was going to be virtually. We wanted it to be a meaningful experience. So we went from selecting 50 participants to selecting about 30, give or take, perhaps 33. But yeah, that's how many we will plan on admitting this go around as well. All right, Anais.
Were those all of the questions?
I believe so.
Okay, well, just to wrap things up, more information is on our website at communityhealthchampions.net, and you can find more info about the program schedule and an application button. We will share this for any of those that RSVP'd on Eventbrite for this event. We'll recap, we'll send this video, we'll send more information, links, and as a reminder, applications are due Sunday, June 20th.
All right. Thanks again, everyone, for joining us this afternoon. And thanks again for Teresa and Amit for joining us as well. And for all your wonderful words. And everybody, enjoy the rest of your day. And we look forward to seeing your applications come through.
Thank
Goodbye,
you.
everyone.